The answer to today's Nclex question. The nurse counseled a client who has tested negative for human immunodeficiency virus, HIV, after a recent exposure to contaminated blood. Which instruction does the nurse provide? A. This indicates that you are not contagious. B. The test shows that you are not infected with HIV. C. You will need to repeat the test in 3 months. D. This indicates that you have immunity to HIV. What should we be paying attention to? First, this person has tested negative after a recent exposure to contaminated blood. Second, false negatives may occur during the first 3 weeks to 6 months after exposure. The answer is C. You will need to repeat the test in 3 months. A repeat test should be done in 3 months and then again 3 months later. This occurs because antibodies to HIV have not reached measurable amounts. Seroconversion is the period of time during which HIV antibodies replicate and become measurable. HIV infection may take up to 6 months to become detectable by lab tests, such as the enzyme-linked immunosorbent assay, ELISA test. During that time, the client is still considered infected and is capable of transmitting HIV to others. Thank you for watching. If this content was helpful, please like, comment, and subscribe.